Alright, I'm going to go ahead and show you how to do a simple interrupted suture pattern. Keep in mind, I am going to be a third-year veterinary student, so I am still practicing, of course, haven't done junior surgery or anything like that, so keep that with a grain of salt. But you're going to go ahead and need some needle drivers, forceps, and some scissors to go ahead and cut the end of that suture. And of course, you will need your suture. Of course, this is makeshift, a sterile environment, so everything right here is sterile. This is on my sterile piece of material with a drape over it. You're gonna go ahead and grab your needle drivers. You're gonna use your thumb and your ring finger and go ahead and grab those bad boys, and then you're gonna have your index finger kind of lay up here, allows you some, control so you can do some movements. You're gonna grab your non-dominant hand, grab your forceps, grab them low and act like you're holding a pencil. I'm gonna get my scissors, put it back on my sterile tray. Then I'm gonna go ahead and grab my needle, and I'm gonna grab it by the middle with my forceps. Make sure not to touch the actual tip, because that'll, blunt the tip and it won't have as good of a drive. So I'm gonna go ahead and take that by the middle, and then I'm gonna mess around with it a little bit so I can get it, so I can have a good grasp. And I'm gonna go ahead and grab my needle drivers. I'm gonna grab it by the end closest to the actual suture material itself, and then I'm gonna go ahead and clamp down once I get a good position in there. And I have a sterile hand technically, and then I'm gonna move my tail, and then I'm gonna get to my laceration here, and you're gonna start from the most cranial aspect and move to the most caudal aspect when you are suturing. So I'm gonna go ahead and take a clean bite here, go under the skin, make sure I'm completely under the dermis there, and then I'm gonna go ahead and follow through. This is a very short needle, and go ahead and make sure it's about even space and looks about the same on each side. Grab the tip, or sorry, not the tip. Go ahead and grab as much of the middle I can. And yeah, sorry, I grabbed the tip there. And then go ahead and take it again. And then again, I have sterile hands. I'm gonna go ahead and help let this through and leave myself a good amount of tail to go ahead and work with. So now that I pulled it completely through, I have, a good amount of space on both sides. It's not too far out, but it's also not too close to the incision. I'm gonna go ahead and drop my needle. Again, it's on the sterile field. And then I'm going to go ahead and do this movement where I turn my needle drivers around so that I have my fingers accessible. And then I'm going to make sure I have a good amount of tail there. And then what I'm going to go ahead and do to make that first throw, I'm going to make a surgeon's knot. 2 loops, grab the tip, and then come through, opposite hand, crossing over, make sure it's nice and not a square knot, and even pressure along that side. And there's the first throw. This suture is kind of ass, not gonna lie. All right, so now that I have that, it's nice and even. My tail end is now on this side and my needle is now on the other side. So I'm gonna go ahead and take my side over here again. Go ahead and make 1 loop now. We'd only do the surgeon's throw for the first one. I'm gonna grab my tail end from the top and pull it through opposite. And I'm gonna go ahead and do that again. 1 throw, grab the tip, cross it over, make sure it's not square, and do it. Keep doing it. And then you go ahead and take both, and you go ahead and cut both the tips, so you have that. So this suture, we can go ahead and review this. So for one, this pad does kind of suck, but we have a little bit of room so it can heal, and it's not too close to the end, and it's roughly the same width from the center on both sides. And then we're going to go ahead and evenly space them across. So now I'm just going to go ahead and go all the way down, and you can kind of see how that progresses. I have like no suture left. Let's see if we can get this last one. Okay, so let's pretty evenly spaced, a little bit wacky right here, but after that one I feel like I was pretty consistent and even. Yeah, I could do better spacing here. The width, these practice pads do kind of suck to like tell. This one I could have went a little bit further out. I already said like the spacing here is kind of whack, but the width of this one's pretty good. Could have been further out. Actually, this one's pretty good. This one could have been a little further out. This one needs a little bit even better spacing. That one's pretty good. This one's pretty tight. This one's pretty good. But so overall, I'm pretty happy with it. If I was in like actual practice, I might go back and fix these two, make a little bit more, you know, evenly spaced, because that's a little bit open. But or I could also just put a little bit of skin glue too, so if I don't go back, you know, depending on time. But otherwise, I would say it's pretty good. And again, I'm only going into my 3rd year of vet school, so please be kind to me, but I am welcome to criticism. Thank you.